All right, party people, we are back at it with clear cell carcinoma. Let's get it. On the screen, there's a histoslide. You will memorize this histoslide. You have to be able to spot diagnose this as clear cell carcinoma. For added value, let's say I give you a patient with a 30-year history of smoking, as well as increased hemoglobin, increased serum calcium, as well as this histoslide associated on biopsy. Now, let's say I ask you, what is the reason for the patient's increased hemoglobin? Some of you might come to the conclusion of saying long-term smoking can cause secondary polycythemia due to chronic lung disease and decreased arterial oxygenation. As a result, there would be an increased release of EPO from the kidney to compensate, which would result in increased hemoglobin. I said, okay, that's cool. That might be possible. However, what really is being tested here is that you must know that renal cell carcinoma can secrete EPO. This would be also a reason for the increased hemoglobin. You also have to know that renal cell carcinoma can also secrete PTHrP. This is the same paraneoplastic mechanism as squamous cell carcinoma of the lung. So to put this into perspective, we have to be able to understand that smoking is the most common cause of renal cell carcinoma, also for bladder cancer and urogenital malignancies. Then we also have to know that clear cell carcinoma accounts for 75% of renal cell carcinoma cases. So could the smoking itself be responsible for that increased hemoglobin? Sure. However, what is really being tested here, what would be the correct answer on your licensing exam, would be you knowing that renal cell carcinoma can secrete EPO as well as PTHrP as paraneoplastic syndromes. This is essential. All right, that's it for this one. Go crush it.